Emollient Combination No. 77 Cream is used as a moisturizer to treat dry, rough, scaly, itchy skin, and minor skin irritations such as diaper rash and skin burns from radiation therapy. It contains substances that soften and moisturize the skin, decrease itching, and protect the skin against irritation from wetness. Dry skin is caused by a loss of water in the upper layer of the skin, and emollients/moisturizers work by forming an oily layer on the top of the skin that traps water in the skin. Common emollients in this cream include petrolatum, lanolin, mineral oil, and dimethicone. It also contains humectants like glycerin, lecithin, and propylene glycol, which draw water into the outer layer of the skin. Additionally, it has ingredients that soften the top layer of skin cells and help the dead skin cells fall off, leaving the skin feeling smoother and softer. It is best to apply this cream as directed by your healthcare professional for optimal results. Make sure to use this product as directed. Some products may need to be shaken before use, so be sure to check the label before applying. Apply the cream to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on the product and your skin condition. For example, if you are treating dry hands, you may need to apply the cream every time you wash your hands throughout the day. If you are using this product to treat diaper rash, make sure to clean the diaper area well before applying the cream. And if you are using it to help treat radiation skin burns, check with radiation personnel to see if it can be applied before therapy. Be sure to follow all the directions on the label for proper use and only apply to the skin. Avoid sensitive areas such as your eyes, inside your mouth/nose, and the vaginal/groin area, unless directed by the label or your doctor. Make sure to consult your doctor or pharmacist for more details. Using this medication regularly will help you get the most benefit from it. It's best to apply the cream after bathing or showering while the skin is still damp. And for very dry skin, your doctor may instruct you to soak the area before using the cream. Keep in mind that long, hot, or frequent bathing/washing can worsen dry skin. If your condition lasts or gets worse, or if you think you may have a serious medical problem, be sure to seek medical help right away. Most emollients can be used safely and effectively with no side effects. However, you may experience burning, stinging, redness, or irritation. If any of these effects last or get worse, tell your doctor or pharmacist promptly. If your doctor has prescribed this medication, remember that your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including unusual changes in the skin, signs of skin infection. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Remember to always consult your doctor for medical advice about side effects and report any side effects to the relevant authorities in your country. Before using Emollient Combination No. 77 Cream, make sure to let your doctor or pharmacist know if you have any allergies to the ingredients in the product. This cream may contain inactive ingredients that could cause allergic reactions, so it's important to talk to your pharmacist for more details. If you have any skin cuts, infections, or sores, it's best to consult your doctor or pharmacist before using this product. Some ingredients in this cream, such as preservatives and fragrance, may make your skin more sensitive to the sun. Be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when going out in the sun. Your healthcare provider may recommend limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing. If you do get sunburned or have skin blisters or redness, be sure to tell your doctor right away. Some products may worsen acne, so if your skin is prone to acne breakouts, look for the term non-comedogenic on the label. This means it will not clog pores. Also, some products may stain or discolor clothing, so ask your doctor or pharmacist for more details. Before undergoing any surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, make sure to tell your doctor before using this product. Additionally, it is unknown if this product passes into breast milk, so consult your doctor before using it if you are breastfeeding, especially if you are applying the cream to the breast area. When using Emollient Combination No. 77 Cream, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's essential to not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of this cream. Always consult with your healthcare provider to determine the best course of action for your specific needs. If this medication is ingested, it can be dangerous. If an overdose occurs and the person experiences severe symptoms like losing consciousness or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. To prevent dry skin, it's important to use lukewarm water when bathing and to keep baths/showers short. You should also consider taking baths/showers less often, such as every 1 to 2 days, and using a humidifier when the air is very dry. Emollient Combination No. 77 Cream is just one of the many types of emollient products available. It comes in different forms such as oils, creams, lotions, or sprays. Consult with your doctor or pharmacist to determine if this product is best for you. Remember to follow the prescribed dosage and use it at the recommended times for optimal results. If you forget to use this cream on your regular schedule, just use it as soon as you remember. But remember not to use too much or use it more frequently than directed. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep all medications out of reach of children and pets. Avoid storing the foam canister near high heat or open flames, as it is under pressure. Do not puncture or burn the canister. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.